I've been working with many children and as well as adults, but my area of interest has always been children because this is the population where we can work on and we mainly see the difference. Because if early intervention is given at the proper age, we can actually see a major difference, and it would be seen in adulthood also how the people who have been given intervention at an earlier age and the ones who have not been given any intervention or any therapeutic practices, they have not been into, you can actually make out a huge difference. So why I'm talking about early intervention, because in my slide also, and I'll be talking about early intervention as well, in ACE it works a lot. So what is adverse childhood events? If you can see the slide itself, it is mainly focusing on the major age range, 0 to 17 years. And why it is 0 to 17 years? Because as we have seen, the brain develops till 24, 25 years of age. And major changes develop from 0 to 17 years. And if any traumatic events occur in childhood, it actually affects your brain a lot. And because it affects your brain, it affects all over your diverse aspects. If we are talking about sense of safety, stability and bonding, it is your environment around you, whatever environment is there. If we are talking about war situation, if there's no sense of safety near the child, if the person is not in a very secure environment, of course it will affect the child's attachment style, because the person understands, or the child understands, that this is something which I am scared of and I can't be in that particular environment. And that activates your all biological mechanisms. So recently only I was talking about, stress and other factors with my students as well. And in ACE, if we consider stress becomes the major factor for adverse childhood events. Because one after the other, if we are talking about any other events, whether it is traumatic condition, whether it is a physical abuse, emotional abuse, or any other thing, maybe war, or maybe you are just exposed to any domestic violence which is happening at your home, that all affects in your brain. So that is how adverse childhood events affect your brain. So talking about types of ACE, first one, that is physical abuse. As we all can see, like especially if I talk about Indian population, because we are from India, Anukriti and me, we all have witnessed that physical abuse is a very common feature in India. I don't know other participants whether they have witnessed there in their countries or not, but physical abuse is taken very lightly in India. And majorly the children are set to, okay, I should hit you, I should beat you, or whatever they are going through, that doesn't matter. You have to be in that surrounding. And if you are being hit also, no matter what, it's very much necessary for you, for that upbringing, that you should develop this a set of standards, a set of moral values, until unless you are physically abused per se. So they don't consider as an abuse, instead they take it as a real thing, that yes, you should be hit and then only you will come out as a good child. Per se, good child. What, why I'm saying good child? Because there's a very much used concept. This is a very much used concept of good child and bad child. And when there is a bad child in the society or the community, we always focus on the abuse aspect. And abuse aspect, why I'm using, you are being hit with the broom, you're being hit with the hanger, you're being hit maybe with a per se anything like knife or anything whatsoever, whatever is freely available in your kitchen or at your home, whatever is there. Especially I have noticed this with alcoholic fathers, which is quite common worldwide, that a person comes at night and literally abuses the child per se, maybe even the mother. And the child is actually getting exposed to all of this situation, whether we are talking about the child or the maternal person, whoever is there, even if it is a mother figure or maybe a stepmother who is abusing the child, it actually affects the child a lot. Talking about sexual abuse is a very much talked about topic right now in India as well, because of certain cases which have been highlighted in news. And sexual abuse is something which is very common worldwide again, and it is prevalent with not only girl child but also boys. That is the main problem, which we always focus on the girl child, but it also affects boys, and boys are never talked about. Sexual abuse which boys have, we never talk about that, because somewhere girl child is very much related to virginity aspect, and a boy child is never ever attached to that virginity concept. So automatically we always focus on the girl child, because we focus that virginity is a very sacred concept, especially if I talk about Indian scenario, because we worship goddesses, we worship, we also consider India as a mother earth kind of a thing. So automatically it is very much related to the sacredness of, a girl child. So if there is any sexual abuse, we can actually see a major difference in brain itself, how it actually changes your neural networking. So your amygdala is activated too much, because there's a fear network which is very much attached to whoever the victim was. And automatically that conditioning happens. And whenever any touch component is there, or any bad touch is there, or even someone is just glancing at you, you actually get triggered. So you are again going into the same scenario. Maybe you are not being abused, but you are experiencing the same flashbacks, the same triggers again and again. So automatically it becomes another, childhood event which is adverse in nature. Maybe it has happened only once, but again and again witnessing the same thing, or maybe the perpetrator is around you, it actually triggers the person a lot. Talking about emotional abuse, so many kinds of emotional abuses are there, but I would focus on mainly marital abuse, where emotionally the husband or the partner is actually using the other partner to just, take off the relationship to another level. Maybe emotionally abuse and take care of the household chores, or maybe financially helping them for the household chores, or as I was talking about alcohol, um, fathers or even alcoholic partners, they emotionally abuse, they sexually abuse, and even physically abuse. So you can see how many events are attached with that only emotional abuse itself. So it automatically affects not only the partner, but if there is a child there in present in the family, the child is witnessing the scenario, and witnessing that scenario is actually very cumbersome. It is actually very anxiety provoking, because the child has that thing that maybe it can happen in the near future with him or her as well. Or maybe he shouldn't get married. Or maybe all people or all men are like that. So all these, conditioning starts working then and there itself. Until unless we remove or we start with any interventions per se, we cannot actually remove that thing. Living with someone who abused alcohol, I have already touched about this topic. Exposure to domestic violence, as I was saying, the same point, that if you are exposed to domestic violence, you have your amygdala activated enough, and automatically you don't know how to react in a situation. Maybe as you grow, as in childhood, maybe you are witnessing the domestic violence, you want to protect, whoever is, the victim there, you want to protect, but you don't have those skills or that much of energy or that physique to actually fight off that situation. But over the years, you become a teenage, you fight it off, you try to literally challenge them, and automatically get yourself abused. That can also happen, which can trigger you into many personality disorders, which I have personally seen, that whoever has been exposed to domestic violence actually have conduct disorder or obsessive compulsive disorder, and even ASPD traits. Living with someone who has gone to prison, this is something which has never been talked about much. But living in prison, of course, the person who has come out of the prison is someone who has not been socially exposed. For them itself, it was a trauma, no matter whatever crime they have done. But for them, it was like they were never exposed to the outside world. And especially if they were in prison for years per se, then for them it is like literally a new world for them. So to make them understand everything, to go through that traumatic experiences, that whatever crime they have done, and maybe they were blamed all over these years because the person who had done the crime was in prison, but the other person who was not there with the prison and was a partner or was a sibling or was a mother to that victim might be there listening to all kind of abuses from the society. So that is something else, that trauma itself is a very, a kind of a bullying is also happening. Maybe it is a sibling, if that was a, elder brother or elder sister to that person. Maybe it was a mother or father, and if it is a caregiver, automatically it tells that, okay, your father is like this, your mother was like this, she did that, or he did that, and he's in prison. So it's like never ending scenario for the person. Next is living with someone with serious mental illness. This I would like to talk about a little more, because serious mental illness, I won't touch depression or I won't touch anxiety. I would talk about schizophrenia, I would talk about delirium, because schizophrenia and delirium comes with their own problematic features, or even Alzheimer's. Schizophrenia, as we all know, it is a very chronic illness, and there is like the protective factors are there, yeah, for sure. But still, there is some element of, that the person is experiencing hallucinations, or the person is having many kind of symptoms where you cannot work on, no matter you're given medications or not. But someone should be there every time with the person, because you never know, maybe the person can attempt suicide. It goes on with every mental illnesses, but schizophrenia or delirium or Alzheimer's have their own, severity levels. So if we are dealing with schizophrenia especially, they might have hallucinations, and they might see that, okay, someone is watching me, someone is, trying to kill me, and they might attempt something, they might harm themselves. So that is the severity level for schizophrenia. Even if we talk about negative symptoms of schizophrenia, their daily health chores, they are not able to do themselves. So automatically the caregiver has to be there, aware about all the things, what has to be done for that particular person. So that becomes very tiresome for the person. Automatically, we are talking about, the experiences, the person who is having schizophrenia along with the person. Sometimes we also talk about shared delusions. If they are having delusions, we also see delusional levels in the other person who is a caregiver. Maybe they are sharing something similar, some kind of similar delusions along with them. So these are rare cases, but I have seen them personally, where the sibling or the mother and the child is very much attached to each other, and mother may be affected with schizophrenia. Automatically, the child is also sharing the same delusions, because the child is taking care of the mother. So maybe the person is having a feeling that someone is trying to kill me. The mother is having that feeling, and the child also develops slowly and steadily over the years that yes, my mother is going to be killed, or maybe I'll be also killed. So there goes schizophrenia. If we are talking about delirium or Alzheimer's, of course, they are neurocognitive in nature. So you never know when they are forgetting, what they are forgetting. Automatically, you have to keep a very close check for them, even for medications, even where they are going. Even you need to be around them, especially if they are stepping out of the house. So that is again very burdensome for the caregiver. Losing a parent through divorce, death, or abandonment. I would like to discuss a case where a child came to me. It is a very recent case. She was just 16-year old, and she was not actually willing for therapy, but somehow I counseled her for 2 or 3 sessions, and then she started opening up. Then I came to know, which the mother didn't tell me. She didn't reveal that she is actually, she had applied for divorce. And then I came to know that the child had attempted suicide many times because the father tried to rape her. And later she came to know that she was adopted as well. And the stepmother who was there, like the father had already married someone else. The stepmother was there, and stepmother had tried to mix poison, which her mother was not aware. So many events she has been going through, which her own biological mother was not aware, because she was trying to take care of the family per se, her own elder sister and herself. And then she went into, she had a relationship which was a very toxic relationship. And again, she tried to attempt suicide. And that's when she came to me. So it was rape, divorce, and you can see uh, even toxic relationship with her own partner. So these are the things, various adverse childhood experiences, and the child was diagnosed with BPAD. So BPAD is bipolar affective disorder, the ones who are not aware. Sorry to use short forms. Okay. So how does ACE impact? So as I was talking about amygdala, I was giving special reference to amygdala because of this only, because I don't know, but yes, I just want to emphasize on amygdala, because how much amygdala is involved in emotions, and how much this hippocampus is always, learning all these traumatic situations and remembering it, and automatically triggering all the events whatever is happening in your life. So one thing must have happened at the age of 5 years, but your hippocampus is very much well aware that this had occurred during my childhood, and these were the emotions which were there present during that time. And whether it is happening at the 10 years of age, your hippocampus remembers everything, your amygdala remembers everything. So it becomes very, very difficult for that person to manage their emotions. They might be very anxious, they might be depressed, might be they are not able to express themselves also what they are going through. So maybe they are happy also, but you cannot see it on their faces. Maybe they are anxious also, but they cannot express that, yes, I'm having a panic attack. Yes, I'm feeling anxious. Yes, I need some water. So they can't express this much also. The capacity to make and keep healthy friendships and other relationships, because they have been there in this upbringing or in that environment where they feel that they are not secure. So they have trust issues. They develop those trust issues. They don't have much bigger circles. And whatever friendships they have, they keep it on a check, that whether I should believe them, whether I should trust them or not. Some people, apart from trust issues, also, maybe they must have interacted. Some people don't have friends per se. Might be they don't know how to talk to a person because they have never been into such deep relationships. Maybe they have not been in friendships also because they have been bullied, because they don't know how to interact. So they have been bullied since childhood. And when they reach adulthood, when they are going for a job interview, or when they are joining a college, they don't know how to keep up or maintain the relationship. Next is the ability to manage behavior in school settings. So, as I was talking about conduct disorder, we can see the children who have experienced adverse childhood experiences actually become very oppositional in nature. So, they oppose all rules and regulations. And slowly and steadily, they become very rebellious. And automatically, we can see very much behaviors which are aggressive in nature, or they might steal, they might be aggressive so much, maybe they are setting fires, so you can see pyromania. All of this you can see when they reach almost 17 to 18 years of age, and probably they get in touch with bad companies. Automatically bad companies, then alcohol, drugs, all of this comes into play. You never know which bad companies they are into. I have seen many pornographic sites they are into, and they mint money after getting into such sex rackets. And after that, they will bring that network. The parents are not aware what is happening with them. What are they doing? They are earning almost 50,000 bucks, INR I'm talking about, 50,000, and they are just 16 years old. It is a huge amount when you are studying in 10th standard or 11th standard, and you are in sex rackets, and you are abusing, you are selling drugs. So how this adverse childhood experiences, because they have never been in that safe environment, they step out, they find companies for themselves. Next is difficulties coping with emotions safely without causing harm to self or others. So this is something which I would again shed light on, that sometimes when you don't know how to manage your own emotions, you start harming yourself apart from others also. So that is known as non-suicidal self-injury, which is there in DSM-5 criteria. But how do they harm themselves, and why do they harm themselves? Because they want to feel that same pain which they had experienced back then. They can't feel that pleasure, they can't feel that pain. So as soon as they cut themselves, or they stab themselves, or they might hit themselves, they're feeling that pain, and that tells them that yes, they are alive, they are sensing some kind of pain. And as I said, as I focused on hippocampus, that memories actually get triggered. So they want it again and again. It actually becomes very pleasurable for them. So they keep causing themselves harm or others also to sense that pleasure. So this is something which actually talks about the gist, how, the childhood experiences become historical trauma, and how genes play a role. So, if you have a mother, or maybe a grandmother or a grandfather, they have their own traumatic experiences, and they have faced all of that, your genetic component is present. Their genetic component is present in you. So, you are passing it down. So, generational embodiment or historical trauma is all about this. And then automatically, if that same person, if it is me, or my grandfather, or my grandmother, or my mother, or my father, is going in that social conditions where the conditions are not that good, it is getting aggravated again. All the traumatic events are getting aggravated again. Along with that, if you have any ACE, any of the ACE which I had talked about, you are again in those stressful events. Again and again, you are experiencing stress, which is changing your neurodevelopmental features. So, neuronal pruning is not happening properly. Maybe your developmental delays are taking into play. Maybe there's a speech delay. Maybe there's a delay in emotions. You don't know how to express yourself, as I talked about. Maybe there is motor developmental delay. You never know which developmental delay is coming from which historical trauma, because everyone is involved there in historical trauma. Plus, the conditions were also not favorable for the child. Plus, there was an ACE. Next is social, emotional and cognitive impairment. If the person is not given, if the child is not given proper caregiving experience or proper relationship or even intervention, at that point of time, it will just impair their development. And you will not see major change, no matter if the child was 5 years of age and you are giving intervention at 10 years of age, not much difference you will see. Maybe 10% difference, maybe 5% of difference. But at the same time, if you give intervention at the age of 3 years only, you'll start seeing the change within 5 years of age. Maybe the person who had speech delay has started talking. Maybe the person who was cranky, who threw temper tantrums, has started expressing that, yes, I am feeling very irritated. What to do? Maybe that person starts expressing. Maybe the person who was not able to do well in academics because of attention problems or because of concentration problems has started, actually telling the teacher or the mother that I am facing problems in this, how to work on that. So these are the things which affect. And then adoption of health risk behavior, disease, disability, and social problems. As the age goes on, as you go on, all these starts developing. It is conditioned, it is stable there. You are not working on any of the prevention factors. And automatically, these stress, as we talk about stress, stress is the main element for all the disorders or diseases. If we are talking about lifestyle disorders, diabetes, cancer, all of them are indirectly related to stress. We all know that. And automatically what happens, there is an early death because there would be a cell damage. Your HPA axis is always activated because you are experiencing so many stressors in your life. So talking about the preventing factors, measures and policies. So this is something from disease control, and what I have seen worldwide. What do they do? So automatically, if a person is coming from a very lower socio-economic status, you can actually work on the financial security. It depends from country to country, of course. So Indian setup has a different financial security. They have their own Vikas programs. Maybe Canada has different Vikas programs or any other programs. So it actually stabilizes their economic, you know, features. And even if we give proper maternal employment, if the caregiver is not there, or if it is a divorcee, how we can help them, how they can meet the basic needs of the child, because it is very, very important for the child to develop physically as well. If physical nutrition is not given at the proper age, automatically it will develop into problems into mental development as well. Public education campaigns. So sometimes we feel that as we talk about bystander effect, that who are we to talk about that? So if there is an accident, we say that why should we go, why should we care? This is the same thing for mental disorders, or if we are talking about adverse childhood experiences also. So if someone is experienced, who cares? But it's not only individual responsibility, but I feel it is a community responsibility. So for that, we should do public education campaigns, especially in school setup, because then only people will be aware, especially for parents, that this is the parenting style they should adopt, and therefore these adverse childhood experiences would affect them in their adulthood. And if this parenting style is adopted, maybe if the child had some adverse childhood experiences also, you can be resilient enough, you can recover from that, because your attachment style or your parenting style has been very, very good. So the environment can be changed anytime, and it can be helpful for the child. So if there are public education campaigns, especially for parents in school setup, or even in college, if there are public education campaigns, it would actually help for the children or the adolescents or the college going students. Next is skills. So whenever we talk about skills, we talk about literally some kind of skill or training they have to go through. No, it's nothing like that. It's normal thing how to protect yourself from whatever is happening at your home, or maybe whatever is happening at your school or wherever you are. So the skills is just teaching the child to be vocal enough that this is happening, where to find help from, and if there is any conflict, how to resolve. So there are many techniques, but what are the basic techniques which you need to know? Be assertive enough. Assertion doesn't mean that you have to be rude, but be assertive enough to tell that these are the problems which I am facing. And automatically, what will happen? Whatever emotions or behaviors which they are able to vocalize, they will be able to work on that with the help of whatever help is available there. Otherwise, what will happen? They will get into all these behaviors which are substance use, and they might be, having sexually transmitted infections, including HIV, as I said, and teen pregnancy, because they have not been told how to use their skills properly. If it is told then and there itself, maybe they are able to stop whatever is happening with them, maybe the physical abuse, emotional abuse, or domestic violence as well. So emotional learning programs should be taught, where they can express themselves more, or maybe how socially interactive they can be, and how they can they can get help from. As I talked about early intervention, so timely access to assessment, again, touching on the same topic. If we are seeing a child who is, 5 years old or 6 years old, if we give them, if we properly assess the child and we start doing whatever is needed at that point of time, we can actually change their families also and the children also. So when we are going through that same model or same, vicious cycle, that this is happening, this is happening, this is happening, what happens? This is getting conditioned in the child's brain. So we need to break that cycle, and to break that cycle you need early interventions for sure. If early interventions are not given, as I told, a 5-year-old child and a 10-year-old child would differ in their development, whether it is emotional development or cognitive development per se. So I'm seeing a child, not a child, twins per se, who have been adopted again, and the environment which they are in is so good that they don't know, first of all, they are adopted, they are just 5 years old, but I have been seeing them from past 1 year, and they have experienced in this 2 years. So when they were 3 years old, they were adopted, and the mother and father had adopted because they were not having a child, and they were around late 40s, I guess. And what happened exactly during COVID time? The father passed away. So, because they had a very good bond, the father passed away, and then the dog passed away, and their maternal uncle also passed away. Everything within, 2021 to 2023. So many changes they have seen, but they have been in that secure environment, safe environment, and they have been given interventions. So this child is coming for behavioral treatment also, play therapy also, plus they are going for occupational therapy also, speech therapy also. We can see amount of change, drastic amount of change within, you can say, 1 year itself, because speech therapy was given 6 months back. They have been coming to me from past I guess October, and last October only, and I have seen a major change. The child was not able to speak, the child was not telling that the nanny is actually hitting them. Now the nanny, as soon as the child is seeing that the nanny is coming with something, she will literally call her mother and literally tell the mother that I'm being hit by nanny. So we have removed the nanny also, but per se, I'm telling that what changes we see within 1 year when interventions are given at a proper time. So now the child is going into a normal school. Earlier, she was going in a very special school where, other special children were also there, but now she's going in a normal school. She is quite good in academics also. Earlier, her social pattern was very weird. We were suspecting autism as well, but now we can see she's interactive, she's playing with other kids. So these are the changes. She has gone through many things, abuse as well, emotional, physical, plus traumatic, because I know she misses her father. I know that she misses her maternal uncle, because when I take therapy for her, I introduce photos of father, and she says to me that father has gone to heaven. She doesn't know the concept of heaven, but yes, she talks about her dog, and she says that yes, my dog is in dog heaven, and the dog can see me, and the dog plays from there, and I can see the dog playing. So it's a very proper attachment style where the person has healed from that trauma slowly and steadily, but for sure the person has healed. As I was talking about safer and secure environments, the same thing. But if we can actually, talk about safer and secure environments, especially when the children are, when they are adolescents, because that's the age where people are changing their habits, patterns, so much of exploration is happening, and that's where you get into bad companies. So if we actually inculcate all these things, all these programs then and there itself, especially during those teenage years, it would be a much, much better, um, thing for them later, at a later point of life. So automatically we are literally getting back. So if a person is going to be in depression, we are just pulling them back from depression. Or if we are talking about personality disorders, because usually we actually, not usually, basically we diagnose a person after 18 years only personality disorder, we are actually pulling them back from any personality disorder. If we are talking about very chronic illnesses, schizophrenia or psychosis, because they have been gone through so many things, we are actually pulling them from all these mental illnesses. So I would end my talk with this. The cure of many diseases is unknown to physicians because they are ignorant of the whole. Why I'm talking about this? Because I am a very big fan of Gestalt, and they talk about whole and part. So we cannot usually, we talk about this category should be, seen for any mental disorder, or we should see this criteria, but we should always work on the symptoms of the person, because symptoms are the part, they make the person. So we should go very slowly with whoever we are seeing, whether the person has gone through a trauma, whether the person has gone through any, adverse incident, or is it a domestic violence incident, or as Kamal was talking about, war situation, because it is a post-traumatic stress disorder. So that is a different category altogether. So you need to give a psychological first aid for that. You need to be receptive to that person per se.